The basic definition of a pharmacist is an individual who dispenses prescription drugs to patients. But within this definition, there are many fields in which you can work. Well, some of the specialization in pharmacy include community pharmacy, hospital pharmacy, industrial pharmacy, wholesale pharmacy, pharmacist in academia, detailing sales pharmacist, pharmacist in public health, among others. How well do you know your pharmacist? Well, on this episode, we'll be talking about the role of pharmacists in community health. My name is Susan Aigbefo, and with me on the show is a seasoned pharmacist. She graduated from the University of Benin. Ladies and gentlemen, I present to you Lisa Onuwabhagbe.
Okay. I think before I talk about the roles of pharmacists in community health, it would be best I enlighten the house on what community health is. Now, community health is a major field of study within the medical and clinical sciences, which focuses on the maintenance, protection, and improvement of the health status of population groups and communities. So there are two basic things one must know there. There's a population group and it involves a community. So the role of a pharmacist now in community health, the roles of pharmacists, I'll list them out before I explain. So they include, but they are not limited to processing of prescriptions, care of patients, as you can call that clinical pharmacy, monitoring of drug utilization, traditional and alternative medicine, responding to prescriptions of minor ailments, extemporaneous preparations, and small-scale manufacture of medicines, informing healthcare professionals and the public, which is a very important role, health promotion, and also disposal of unwanted medications. So now explaining all these roles I've listed. Now, processing of prescriptions. Now, when a doctor writes a prescription for a patient, the patient brings the prescription to the pharmacy. And what the pharmacist does, he assesses your prescription. Now, he's assessing for two major things. He's ensuring that the prescription contains all the basic needs of the patient.
Okay.
Secondly,
Can you explain this?
okay, now there are about 5 basic needs of a patient's medication. You must ensure that all conditions are met. You must ensure the drug is safe. You must ensure the drug is efficacious. You must ensure there are no adverse effects. And you must ensure that it's addressing the cause of the condition. So you must ensure that all those basic needs are met. Now, secondly, you must assess the prescription for any drug therapy problem. Now, there are about 8 classes of drug therapy problems. You have unwanted side effects. You have drug overdose. There are different classes of drug therapy problems. So the pharmacist assesses the prescription for all this, and when the pharmacist has properly gone through the prescription and sees that everything has been met, the pharmacist dispenses the medication to the patient, or the pharmacist passes the prescription to a pharmacy technician. Now the pharmacy technician dispenses the medication. After the medication is dispensed, the pharmacy technician gives the pharmacist back, and the pharmacist counsels the patient on the use of the medication. Where you see them tell the patient, take this 8 hourly, take it 12 hourly, and any other drug concerns the patient may have. Probably I react to this medication. How best can I take this? What should I avoid while taking this medication? The pharmacist handles all that.
I know some people that actually just take drugs without even reading the leaflet
To know the dosage, the number of hours intervals that you should take.
Exactly.
Really?
So that's where the pharmacist should come into play, because in our society, many patients are not health literate. So they don't take time to read their leaflets. And if you see some leaflets are like textbooks. They are very big. Exactly. And the prints are so tiny.
Really discouraging.
So exactly. So the pharmacist just tells you the basic. That's how you should take the medication, side effects you may encounter, and what's, like, for example, the patient you dispense Piriton to. You tell the patient, okay, this medication may cause you to be drowsy. So while you're taking this medication, ensure you don't operate any machinery, ensure you don't drive. If you are working, to avoid issues at your workplace, ensure you take the medication in the evening when you can sleep. Certain things. So that's what the pharmacist does for you. Then also I mentioned care of patients. Now it's pharmacists ensure with the new regime of clinical pharmacy, because pharmacy didn't initially start as clinical pharmacy. We ensure that everything we do has the patient at heart. Must be for the benefit of the patient, to ensure that the patient is the center of everything you are doing. You must not be gain conscious or product conscious. So you must ensure that everything you are doing, the medication is safe for the patient. The patient has all the knowledge he needs to take the medication and all that. Then I also mentioned monitoring of drug utilization. Now, this is a very important role for pharmacists. They have to participate with the healthcare team to ensure drugs dispensed, prescribed and dispensed to patients are properly used. For example, you find out that in today's society, you find out that over 80% of patients are not adherent to their medication. They take it the first day, the second day, third day, they are no longer using the medications. Some don't adhere to the dosing intervals, and that's very important. 8 hourly, 12 hourly, some take it haphazardly, just anytime they remember. So pharmacists monitor drug utilization, ensure the drugs are being used as they should be used.
So how do you aim at achieving this? How do you monitor them?
Now, first thing, like when you're counseling, you ask the patient, do you have any worries taking this medication? Will you be able to stick to the regimen of 8 hourly or 12 hourly or 6 hourly? There are some medications you must take every 5 hours. So once the patient tells you that he can't do that, you can substitute for other, yes.
Okay.
So yes, there are different methods you can substitute. You can advise the patient on methods to use. For example, you can tell the patient, okay, why don't you tag your medication to something you do every day? Let's say you immediately after every meal, just take the medication, or anytime you go to shower, if it falls in line with the dosing interval, or there are prescription boxes that they give patients.
Okay.
So once you see the box is empty, you know you've taken it. Once you know, yes, for patients that may forget. And also there are pill reminder apps that remind patients. So once it just rings, you just know that, yes, it's time for my medication and stuff like that.
Okay.
So I also mentioned traditional and alternative medicine. In a country like Nigeria, you find out that this is highly practiced. Alternative medicine, traditional medicine, the use of herbs. You can enter a bus, you hear the patient telling you about Bobunishe that works for all your conditions.
Yeah.
Some are licensed, some are not licensed, but they're actually herbs and traditional medicine that actually work for certain conditions. They are herbal leaves, they are leaves that really help. So pharmacists are taught in school some of these herbs, some of these leaves that work to treat certain ailments, and also they advise patients on the use of these herbs because some could be very dangerous because of dosing.
Side effects.
Yes, some they are not titrated. There's no specific. You can't say you're taking 10 milligram of the herb
True.
or 20 milligram of the herb. So there has to be proper counseling when telling a patient, oh, take this herb, ensure you don't take it, and there could be very serious side effects and drug interactions. So we tell them, if you're taking this herb, ensure you don't do this, ensure you don't do that. Now, I also mentioned responding to prescriptions of minor ailments. Now, when a patient, you find out that most patients here, especially in Nigeria, they are very scared to go to the hospital when they are sick because they are afraid of the cost. They have to pay for hospital cards, they have to pay for case files, they have to pay for consultation, and by the time they pay for all this, already approaching about 1,000 or about 1,000 plus. Yes, and exactly, and many of them don't have this. So you see that when they have minor ailments, the first thing they do, they have community pharmacists that are close to them. Oh, this is my community pharmacist. They go, oh, my child has been coughing for about 3 days. The pharmacist collects them. What kind of cough? Is it dry? Is it so minor ailments? However, pharmacists know the border. They know where they are restricted. And once they see a condition that the patient comes to meet them and they see it's over, that they can't handle this, they refer. So most times, and this also helps to take the burden off the healthcare team working in the hospital. Once the community pharmacies attend to basic minor conditions, you find out that less people are waiting in the hospital, so the doctors can attend to more severe cases. Also, I mentioned informing healthcare professionals and the public. Now, this is a very important information. Your pharmacists are your drug experts. They know all about the medication and all that. They are doing constant research on drugs. So any information pharmacist knows about drugs and all that, it's their duty of the pharmacist to inform other healthcare professionals, the doctors working with them, the nurses. Okay, there's this new medication or there's a discovery on this medication we used to know. For example, let's say lisinopril that is used for treating blood pressure. Most times you might find some patients coming back because they develop cough. It causes cough as a side effect. So some patients using this to manage their BP might come with serious cough. And you see a prescription for a patient on lisinopril. You are seeing cough syrup. It's up to you as a pharmacist to go back and see the doctor in the private area. Oh, this prescription, the patient is actually on lisinopril and this causes cough. So treating the cough with cough syrup won't make the cough go away because it's the drug that is causing it. So you inform the healthcare professional. You can also inform the nurses on how to give a medication or stuff like that. So that's one also important function of a pharmacist. And I also talked about extemporaneous preparation and small-scale manufacture. So in some hospitals and some community pharmacies, you find out that pharmacists make quick preparations of some medications. For example, you might find a child of about 3 months who is having a cardio disorder, a dysfunction in the heart and all that. I might need like a syrup of digoxin. These drugs are not prepared on ground. So a pharmacist makes a quick preparation of this medication specific for the child. So you find pharmacists also doing that. It's called extemporaneous preparation. And lastly, I mentioned disposal of unwanted medicines. Now, we all know that drugs are poisons, just that they are poisons in safe concentration. So medicines are not meant to be disposed anyhow. When you want to dispose a medication, the normal thing or the right thing to do is give them to your pharmacist. Your pharmacist disposes the medication for you. You're not meant to just dispose your medication just as you like, because it could cause a lot of serious health hazard. They are poisons. So with this, those are the most basic functions of the pharmacist in community health. Though, like I said, it's not limited to this. So in summary, there are 3 main roles of the pharmacist in community health. You have the role to patients and caregivers. You have their role to other healthcare professionals. And you have their role to the healthcare system. So basically, these are the functions. So a pharmacist practicing in a community setting or in community health can have patients asking them questions like, I'm taking a medicine for a long-term medical condition. Can you explain to me how I should use this to manage possible side effects? So as a pharmacist, you should be able to respond. You could also have a patient coming to meet you that I'm having issues with my sexual performance and all that. As a pharmacist, you should not laugh or you should not show emotions or show expressions. You should be able to clerk the patient very well. Also, you might have a patient coming to meet you to tell you that he's experiencing an STI, as a sexually transmitted infection, and you find out that he had this from sleeping with someone who is not his wife. It's not up to you to carry religion or tell the patient what you did is not right. Yes, or try to. Yes, as a pharmacist, you shouldn't be judgmental. So you advise the man, okay, next time you want to see a lady, ensure you use a condom. Ensure you take you. So you should be very professional and not allow your emotions or your religion or anything to come into play. You must be as professional as possible. So the future of pharmacists in community health will be to complement and reduce pressure on other parts of the healthcare system. That's enabling patients access the care they need when they need it and where they need it.
All right, thank you. A few questions. Now, I remember trying to get a drug for malaria that was prescribed to me by the doctor. And then I got one, the price was 1,2. I got another one, the price of 400. What exactly is the difference? For a layman, would you tell me that the one of 1,2 works faster than the one of 400 or what?
Actually, in normal sense, it shouldn't be so. Okay. Why I said in normal sense, why it shouldn't be so. I'm taking Nigeria as a case study. Mm-hmm. Now, those that are more expensive, they are called the innovator brands. They were the ones that came up, they were the ones that discovered the drug. For example, let's say we have a particular medication that is the branded, they call them the branded ones. These are the innovator brands. They're the ones that discovered, they started the production of these drugs. Okay. So they are giving copyright or patents, something like that to the medication. So theirs are usually more expensive and most times theirs are usually more potent. They are more efficacious. So the other ones are called generic brands. They are generics. So but both contain the same active ingredients. For example, you can say like you said, anti-malaria. The basic ones are ACTs, that's artemisinin combination therapy medications. So for example, like Lonart and Locmal, both of them are the same thing. Like Atequick and some other medications, they are basically the same, but the difference is this is an innovator brand. The other one this is a generic brand. Hence the difference in price and all that. Sometimes it might be the materials used. They're basically the same. They work the same. I'm the co-founder and I'm the CEO of MedPlan.
I just needed you to say it yourself. Right. Okay, so ladies and gentlemen, she's the CEO of MedPlan. She's going to tell us all about MedPlan. I'm sure you're going to be interested in this particular episode.
Okay. So MedPlan is a digital health company. Now it's the owner of the app called MedPlan. MedPlan is actually, the name of the company is actually MedPlan Solutions, but we have our app called MedPlan. Now MedPlan is a 24/7 health companion. When we tell people it's a 24/7 health companion, they're like, what do you mean? Mm-hmm. What do you mean by 24/7 health companion? Now, I just tell them, it's easier to relate things to people through stories. Now, imagine a patient A. is comorbid, meaning she has many conditions. Let's say she has hypertension, diabetes, she's an elderly patient, she has dementia, she forgets to take her medication. Now imagine she's on multiple medications. She'll need to have an app to remind her about her medications. She'll need to have an app to remind her about her doctor's appointments. She'll need to have an app to remind her about her health vitals, let's say her BP checks, the values over time, her sugar level. She needs to have an app to store her personal record, like her blood group, her genotype. By the time you look at this, she has so many apps on her phone. Now with MedPlan, you have all these features combined in just one app. So MedPlan, that's why we call MedPlan your 24/7 health companion. He has everything a patient needs just in one app. So it has a peer reminder feature. It has a doctor appointment reminder feature. It has a medication notes area where you document personal experiences like side effects, allergies from medication, so that anytime you see your doctor, you can just tell him, this drug you gave me. Because most time you find patients, they come, they'll be like, there's a drug you gave me at a particular time, I don't like it. What's the name? They can't remember. Tell me the name, I can't remember. But that drug, can't you remember, doctor, now that drug you gave me? Yes, so with that, they can just document the name at that moment and all that. So it also has a feature dedicated to women's health.
Really?
Yes, there's a feature dedicated to men's health also. There's a blog there. So it's a complete health companion for anybody. So I think you should check it out.
It's really awesome. How do I get to check it out?
Okay, so to get MedPlan app, you just go straight to your Google Play Store and search for MedPlan. You get the app there on Google Play Store. It's coming soon to iOS, so from...
Oh, that is big. So you go to Google Play Store, check for MedPlan, your 24/7 health companion. I must say it has been interesting, insightful, because I've actually learned a lot from this conversation. So your social media handle, in case most of the listeners want to converse with you.
Okay, so on Facebook, we are called medplan.ng.
Okay.
Also on Instagram, medplan_ng.
Okay, so on Facebook it's medplan.ng, on Instagram it's medplan_ng. Then on Google Play Store you can get it at MedPlan, right?
Yes, sure.
MedPlan, your 24/7 health companion. Thank you so much, Lisa, for your time. I believe it won't be trouble getting you again for another episode, right? Definitely. Thank you. Yours sincerely, Susan, signing out from this particular episode. I hope you've learned a lot, because I have.